in the interest of this being a standalone podcast for people who don't know what ibogaine is and don't understand the efficacy of it and how unbelievably effective it is at especially treating addiction, could you please just go over that?
Yes, sir. So ibogaine is an alkaloid that is derived from the iboga shrub. The iboga shrub originates in the central Congo basin. Its native country is modern-day Gabon. It is the mother country of the iboga shrub, which has been used for centuries in the spiritual and cultural traditions of the Buwiti, a group of spiritualists who include the Pygmies as well as the Bantu tribes that live there in Gabon. In the early 60s, it was discovered that ibogaine and iboga had a significant interruption effect on opioid addiction. There was an individual who had been addicted to heroin for a number of years. They took ibogaine, and not only did they not experience any withdrawal when they stopped taking heroin, they stopped having any desire to use any drug whatsoever. This touched off 60 years of open label field studies that are mountains high and decades wide that firmly establish that ibogaine has a unique and singular interruption capacity on physiological substance dependency, whether that's opioids, alcohol, methamphetamine, cocaine, or tobacco. Recent evidence also suggests that it has a significant interruption effect on compulsive behaviors, anything that kind of impacts that brain's dopamine system and produces a rush.
Particularly gambling.
Yes, sir. Now, in 2018, U.S. Special Forces special operators started going to Mexico for treatment of symptoms of traumatic brain injury, expressed through treatment-resistant depression, anxiety, and suicidality. Many of these veterans had gone through the VA system. They had been given an unbelievable amount of synthetic pharmacology that, in their end effect, essentially anesthetizes the soul and slowly euthanizes the body. And they were at the end. So as they were going to Mexico and would get ibogaine treatment, they came back with these just unbelievably just powerful recovery results that seemed too good to be true. So there were some scientists at Stanford University that were funded by philanthropists who wanted to understand what was going on. And so what we have come to learn through a Stanford research study on traumatic brain injury for vets is that ibogaine has remarkable neuroregenerative capacities on the brain that are unheard of in the annals of Western science. And while information is still very small in amount and preliminary, there are individuals who have had ibogaine treatment for not just traumatic brain injury, but for multiple sclerosis, Lyme disease, Parkinson's disease, post-surgical complications related to the removal of brain tumor who endorse a restoration of functionality and an ability to live that are otherworldly. And as we recognize that the opportunities to improve the human condition at scale are multi-lifetime in appearing, we believe that we have found one of those. And if we're going to do justice to the human species, it is incumbent upon us to take what appears to be a promising therapeutic improvement and deliver it with speed through the U.S. medical systems, and that's what Governor Perry and I have founded Americans for Ibogaine to do, just that, achieve the moonshot of our time, and that is to bring ibogaine medicine to the American people as quickly as possible.
Well said. And thank you again, Governor Perry, because if it wasn't for your involvement in this, I think a lot of people would be far more skeptical